Hello everyone, welcome to my YouTube channel Nursing Education. Today I'm going to talk about cardiotocography, its indication and component. If you have not subscribed to my channel yet, please do subscribe and press the bell icon to get more video when I upload the video. Cardiography or CTG is a record of the fetal heart rate and uterine contraction during the pregnancy as well as during the labor, which is a measure from the transducer. This paper which you are seeing is called as Cardiograph, where you can see the fetal heart rate and uterine contraction record. So in this slide here you can see the transducers. So these two are the transducers. One of them are placed over the fundus and another is at a site where the fetal heart sound is clearly audible. So this one is that. Before placing the transducer, you have to find out the fetal heart sound and then place the transducer over fetal heart sound. You can see on the picture on the right hand side, transducer is sensing the uterine contraction and fetal heart rate. So here you can see the cardiograph. On the cardiograph, this one is showing the fetal heart rate, upper one, where you can see the baseline heart rate is 140. I'll talk about this component later on in this presentation. Here you can also see the uterine contraction in the lower part of the cardiograph. These two components help to find whether the CTG is normal or abnormal. Let's talk about the indication. We do not always do the CTG for every pregnant woman until there are any indications such as high-risk pregnancy. If the pregnant woman is suffering with heart diseases, hypertension, and woman is elderly priming gravida, but the woman is pregnant for the first time over the age of 35 years, in that case we do the CTG. We also do the CTG if the pregnant woman is suspected intrauterine growth retardation, where the baby inside the uterus has not grown properly. CT is also done if the woman have history of any obstetrical problems such as miscarriage, preeclampsia, bleeding, etc. CTG is also done if the pregnant woman complains of or come to the hospital with the less or no perception of fetal movement. We also do the CTG if the woman is post-maturity pregnancy. We do CTG if the pregnant woman cross the due date to see the fetal well-being. Another indication is antepartum hemorrhage such as placenta previa and abruptio placenta. Placenta previa is when the placenta is completely or partially covered the cervix, and abruptio placenta occurs when the placenta separates from the inner wall of the uterus before the birth. We do the CTG during the labor and if the woman are negative blood groups and is at risk of Aeration incompatibility. Interpretation of the CTG. To interpret the CTG, we have to look at the four variables on the cardiograph: baseline fetal heart rate, baseline variability, acceleration and deceleration. We also look at the uterine contraction and compare with the fetal heart rate when we interpreted the CTG. I'll talk about its component in detail. The baseline fetal heart rate is the first component. Is the mean level of fetal heart rate during the 10-minute window. We have to exclude the acceleration, deceleration and any periods of marked fetal heart rate variability when we assessing the baseline fetal heart rate. So acceleration is this one, increase in fetal heart rate from the baseline heart rate. Then deceleration is decrease of the fetal heart rate from the baseline heart rate, and variability is a variation of fetal heart rate. So we have to exclude three components: acceleration, deceleration and fetal heart rate variability, which is a marked fetal heart rate variability which will be greater than 25 beat per minute. So these three components we have to exclude when we assess the baseline fetal heart rate. So this is the baseline fetal heart rate and that is 140. So basically acceleration is increase in the fetal heart rate from the baseline heart rate, and deceleration is a decrease in fetal heart rate from the baseline heart rate. When we are excluding the fetal heart rate variability, we have to see that fetal heart rate variability is greater than 25 beat per minute. The normal baseline variability is 5 to 25 beat per minute. If it is more than that, then we should find out the cause, because that is abnormal and it might be due to the cord compression or mechanism strain. So baseline heart rate is 140 beat per minute in this cardiograph. Next component is a baseline fetal heart rate variability. So variability is basically the variation in the heart rate. Baseline fetal heart rate variability is defined as a fluctuation in the baseline fetal heart rate that are irregular in amplitude and frequency, excluding the acceleration and deceleration. Basically, the variability is a variation in the fetal heart rate. Obviously, there should be variation to have the normal heart rate. If there is no variation, that is obviously abnormal. There is no fetal heart rate if there is no variation. The average variability is at 20. Any variation in the fetal heart rate is between 5 to 25 beat per minute is considered normal. More than 25 or less than 5 is considered abnormal. Increase in fetal heart rate may be fetal heart rate variability may be due to the cord compression or mechanism strain. Decrease in the fetal heart rate variability could be due to the fetal hypoxia, congenital heart disease, and the metabolic. So these are the variability, the 20, 15, 22, 18, these all are normal baseline fetal heart rate variability. Next component is the acceleration. So basically the acceleration is increase in the fetal heart rate for greater than or equal to 15 beat per minute from the baseline fetal heart rate. So this one here, this one is a baseline fetal heart rate. This increase in the heart rate is called as acceleration. So increase in the fetal heart rate from the baseline heart rate should be at least 15 beat per minute or more than that, and it should be last at least for 15 seconds. So to call the acceleration, fetal heart rate should be increased at least to 15 beat per minute from the baseline heart rate for the 15 seconds. And in the 20-minute period of CTG, there should be at least 2 acceleration to call the normal CTG. Next component is a deceleration. So deceleration is the decrease in fetal heart rate. So this is a deceleration. Decrease in the fetal heart rate from the baseline fetal heart rate. So is a decrease in the fetal heart rate below the baseline for equal to or more than 15 beat per minute, which should be lasting at least for 15 seconds. So there are different type of deceleration. I'll talk about deceleration in a separate video, next video. When you compare the different type of deceleration, we have to compare with the uterine contraction and then identify which type of the deceleration is